Hello, and welcome to the module Finding the Evidence, Mission Impossible. My name is Ingrid Hendricks, and I'm the Nursing Services Librarian at the University of New Mexico Health Sciences Center Library. If you have questions about any content covered in this module or anything related to accessing information, please contact me at either ihendricks@salud.unm.edu or hsc-askingrid@salud.unm.edu. In this module, I will be introducing you to some nursing-specific resources available through the UNM Health Sciences Library. I will also review a formula to help you in creating an answerable question that you can use when searching the literature. Finally, I will demonstrate some tips and tricks for more successful and efficient searching. I'm sure many of you use Google as your go-to search engine. That's understandable since it's easy to use and you can always find something. But Google is also a little bit like drinking out of a fire hose. You get a lot of information which you then have to sift through to determine what's good scholarly information. Databases like PubMed and CINAHL, the Cumulative Index to Nursing and Allied Health Literature, have already done a lot of that work for you by choosing articles relevant to health sciences research. So in this example, if you were to type in the exact phrase listed there, risk factors for falls in inpatient rehabilitation, you get 142,000 records in Google. If you use Google Scholar, which is a little more narrowed down, you get a little bit less at 35,000. You get 4 in CINAHL and 108 in PubMed. So which database would be a better use of your time? Now, don't get me wrong, I like Google and I use it quite a lot. It's a great way to find a quick fact or sometimes find a full text article. For those really hard to find topics, it's a great place to start. It's also a good resource for statistics, since much of that is collected by government agencies, and Google can access those because they're all available for free. But Google can be challenging to use for scholarly research for a number of reasons. You've already seen the difference in your retrieval on a previous slide, and I also mentioned how you have to do your own quality filtering in Google. There's also a time lag between what appears in Google and when it appears in PubMed. And the reason articles appear at the top of a Google search is based on popularity. Despite the fact that you get a lot of results in Google, you're not searching all the information that's out there, such as subscription databases that the library pays for. If you want to use a search engine like Google, I would suggest focusing on Google Scholar, as it has already been somewhat narrowed down, but you still run into the same issues as you do with regular Google. There are two types of questions. One is called a background question. These types of questions answer basic knowledge gaps, such as what is scleroderma, or what are the complications of chronic kidney disease. These types of questions can be answered by looking in textbooks or in review-type databases like UpToDate. Access Medicine and Clinical Key are two databases available through the library with the full text of over 2,000 textbooks related to health sciences. So these are good resources to use to find out background information on a topic. For your papers or presentations that you're doing, you're usually trying to answer what's called a foreground question. These types of questions focus on the current available research evidence to determine the best treatment or intervention. An example of a foreground question might be, in hospitalized adults, how does a rapid response team compared with no rapid response team affect the number of cardiac arrests and unplanned admissions to the ICU? Good resources to use to answer these types of questions would be PubMed, CINAHL, or PsycInfo if it's a behavioral type health topic. PubMed focuses on clinical topics with a strong focus on medicine, although it does cover some nursing journals. CINAHL is specific to nursing and is a good place to find articles on nursing-centered topics. In preparing to search, there are a few basics to understand before sitting down at the computer and beginning your search. One of these is understanding how Boolean operators work. Boolean operators are and, or, and not. In this diagram, the green shaded area represents articles showing the intersection of autism and play therapy. So the area in green represents articles that talk about both the topics, autism and play therapy. The blue circles represent the OR Boolean operator. You would use OR when you're trying to expand your search. You would think of synonyms or words that are similar and connect them with an OR. So in this example, you would get all the articles on either exercise or all the articles on movement or any articles that talk about both. Another example of this would be if you were searching on MRSA. It's a good idea to not only put in the acronym MRSA, but also use the phrase methicillin-resistant Staphylococcus aureus. So in that case, you would type in MRSA or methicillin-resistant Staphylococcus aureus. The final diagram, in purple, shows articles where you would be searching for students but not faculty. I seldom use the not Boolean operator because sometimes you end up missing useful articles that talk about both students and faculty. So for the searches that you all are doing, I would focus on using the and the or. As I mentioned before, it's a good idea to think of similar keywords in case one term you use does not result in useful articles. In this example, showing the image of this popular drink and asking people to say what it is, you get many different responses, all of which are synonyms for the same thing. So if you wanted to search on articles about this item shown, you would type in soda or pop or Coke or cola or Coca-Cola or beverage. That way you make sure that you're covering all your bases and you don't miss any articles. Before you begin your search, you want to develop an answerable question. Before you start on any journey, you want to have a roadmap to know where you want to get to. If someone invited you to a party in, say, the Northeast Heights in Albuquerque and didn't give you the address, you'd be driving around for hours and get frustrated and probably never find your destination. The same thing is true of searching. If you don't have a good idea of where you want to go, you will be looking around for a long time and get frustrated. If you sat down at the computer and just typed in breast cancer, you would get thousands of articles. So before you sit down, you want to decide, what about breast cancer are you interested in? Do you want to know how successful support groups are for survivors of breast cancer? Are you comparing two different types of chemotherapy, etc.? So by focusing your search, you will spend less time looking through irrelevant material to find articles that meet your specifications. To help you create an answerable question, there's a popular format known as the PICO format. The P stands for patient or population. This is who you're looking for, or the group that you're looking at. For example, preterm infants in this example. The I stands for an intervention, say kangaroo care to develop a bond between the mother and the preterm infant. The C stands for comparison, which may be another intervention or it may just be the standard of care, which could be leaving infants in their incubators. The O stands for outcome. You aren't necessarily searching on the outcome in terms of typing in keywords, but you're looking for whatever the outcome is in the literature. So you would be looking in the literature to see if perhaps by implementing kangaroo care in a NICU, you would see an increase in the bond between the mother and infants, or maybe reduced crying or increased breastfeeding. So let's say you're a nurse in the medical ICU and you're concerned about the slow recovery time of patients you have on ventilators. Someone you know mentioned that it was possible to get these patients up and moving around and that would decrease their length of stay. So you decide to do a little research and see if this might be an intervention that you could pilot on your unit. So the P, or the patient population, is ventilated ICU patients. The I, which is your intervention, is early ambulation. Your comparison, or C, is doing what you've always been doing, which is leaving your patients in bed. That's your current standard of care. Your outcome that you're hoping to see is faster recovery time and decreased lengths of stay. So to break the search into keywords you would use, it might look something like this. You would use the keyword of early. You would then AND that with mobilization or ambulate or walk. I'm putting the parentheses around those terms because I want the computer to search them together and search for either mobilization or ambulate or walk. The asterisks, or little stars that you see behind the T and the K on ambulate and walk, is telling the computer to truncate those words, meaning it will look for walk, walking, walks, walkers, etc., ambulate, ambulating, ambulation. So it broadens my search in addition to using the ORs. Then I'm going to use an AND to combine those groups with either the word intensive or critical, because the patients I'm looking for are either in the intensive or critical care units. I'm not putting in care units afterwards because intensive or critical should still pull those up. I'm going to AND that with my final term, which is ventilate with an asterisk. So I get ventilate, ventilators, ventilation, etc. Now in our next module, we'll be going to the Health Sciences Library and go to hslic.unm.edu and run this search and see how it works in PubMed and CINAHL. So stay tuned.